We bring together experts from our membership and their strategic partners. And some of the key projects we've helped facilitate in the past include Connected Health Cities, which was a government-funded pilot between 2016 and 20 that put informed and consensual use of citizens' health data at its heart and delivered a number of excellent population health and service evaluation projects through the various regions of the North. And through the successful collaboration and networking of that programme, it helped to form the framework for the Northern Better Care Partnership, of which NHSA is a partner, and that launched HDRUK North in May last year. The partnership brings together unique data assets and infrastructure from our membership and world-leading expertise in clinical care and research. And HDRUK is represented today by Monica Jones, who has a number of hats, but today is Data Governance and Architecture Cross-Cutting Theme Lead for HDRUK North, and also the DataCan Chief Data Officer. Monica will firstly give an overview of HDRUK North and then the National Cancer Trusted Research Environment. And at this point, I'm handing over to Joann Rhodes, who's Chief Executive of HIRANI.
Thanks, Helen, and delighted to be with you today for this session for a deep dive into health data and driving research and innovation to improve patient outcomes. So just a tiny piece about HIRANI. So HIRANI is recently established. It's a not-for-profit alliance, similarly to NHSA, of universities, healthcare providers, and businesses here, and it's designed to unlock growth and collaboration for health and prosperity. We successfully secured £2 million of funding, of mixture of cash and in-kind support in January this year, and are busy developing our programmes of work. As you can see, a number of partners across the bottom that stretches right up through into the Department of Health and Department of Economy here in Northern Ireland. And as Helen said, I'm the Chief Executive here, so we're rapidly developing our programme of work, and also we'll be hiring shortly as well to develop those programmes further. Next slide, please. So I'm sure many of you know where Northern Ireland is, but just a little bit of scholarship. So here it's in the northwest of the United Kingdom. It's around 2 million people, or just under 2 million people population, so somewhat smaller. Two large universities with 4,500 graduates in health and life sciences a year, and over 1,000 researchers spread across at least 10 centres of excellence in health and life sciences. There's 5 trusts employing about 66,000 staff and a greater than £400 million of research income. In contrast to other parts of the UK, we've got a largely SME-driven ecosystem in health and life sciences with greater than 300 companies. And there's an annual turnover of 1.1 billion. So this represents just over 10% of the turnover of Northern Ireland. So it's a significant portion there. Next slide, please. So just really to give you a flavour today, the HDRUK Health Data Research Professor Lawler is a professor of digital health at Queen's University Belfast, so that's the connection there through to HIRANI. He's associate director for HDRUK and HDRUK North. Oh, sorry, apologies, that's a typo. He's associate director for HDRUK and responsible for HDRUK Wales and Northern Ireland, and scientific director for DataCan. So today he's going to give you an overview of HDRUK Wales and Northern Ireland, and also perspectives on COVID-19 and cancer, national and international impacts on care. So we'll hear from him in a moment after Monica. But one of the things I think I really wanted to just pull down of what having HDRUK present in Northern Ireland has really done, especially with the pandemic, is the pandemic plus data plus the ecosystem that we've here is really developing new insights. And so HDRUK currently are not involved in this consortium, but it's kicking off across stakeholders in Northern Ireland that HIRANI is involved in, and that's the Northern Ireland Multi-Morbidity Research and Discovery Consortium. So that's clinicians, some of these centres of excellence for health and life sciences, the 2 universities are really pulling together a programme that's piloted from the beginning of this year, and it's really to address some of the operational and governance and ethical challenges associated with federating clinical, academic and administrative data sets. And this aims to leverage academic health data strengths and collaborate to integrate those across Northern Ireland. I think that's one of the benefits of having a fairly small population, is that we can really interact across all of those units quite easily, and the hope is that this whole infrastructure will underpin and give a rich multi-point data-driven infrastructure to develop new hypotheses and improve diagnosis and disease management. So I think it's really critical what having HDR UK spread out across the regions means to us. So that's my plug for that, and hopefully we'll be successful in our Wave 2 application coming later this year. So I'm just going to hand over now, I think, to Monica and Mark, and they will be introducing HDR UK and then also HDR UK North and HDR UK Wales and Northern Ireland. So over to you, Monica.